She has had one foot in the medical field, being obstetrician, and the other in bioethics, and she actually is a professor in bioethics in South Africa, Johannesburg. So, and she is also the president of the South African Medical Association, and you have done a lot of thinking about the biobanks, which we are now entering. Please.
Okay, thank you for the introduction. Good afternoon. It's still morning, so good morning everyone. After listening to the different member countries and what you have, and hearing to the different societies, what the different societies have, I thought, well, now you're going to listen to what an African society actually comes up with. I must say, I feel, I don't know whether it's neonatal or embryological at this moment in time, in terms of our policy and legislative developments, you know, when I've listened to where you are at your different countries with regard to human data storage. And so my presentation is going to actually come through, I'll start off with what happened when we had a request to our Research Ethics Committee to approve a national biobank. And that was in October 2012. And some of our Research Ethics Committee members says, bio what? Bank? So it was the first time they were hearing of something that was as large as our first national bank, or Barclays Bank, that was now storing human specimens. So we just chatted with some of our students at the undergraduate level, and I spoke to my two children who were at a postgraduate level but not medical, and they'd never heard of the concept of biobanks. So that's where we were, and we probably still are in South Africa today in 2014. And from this request, we started examining how our multicultural diversity in South Africa would actually respond to a situation of biobanks in the country. We looked at who would actually set the standards, and we consulted with our government. No one knew who was going to actually set the standards. And so we looked to see what our international guidelines would say. And so we found in the Declaration of Helsinki the importance of the Research Ethics Committee actually standing in as a substitute decision maker. And that's where we drew from in terms of the important role that the Research Ethics Committee would play. But we felt that we needed much more than just a Research Ethics Committee. We needed something more specialized because this was something totally new to us. And while there are ethical issues associated with research in the generic term, there are ethical issues associated with biobanks that are specific for biobanks. And so our ethics committee went and established a biobanks ethics committee. And we then set out to put together a principle, a policy document on biobanks, that every application for biobanks, either to establish or to have movement within or between biobanks, would have to adhere to. So I'll take you through our story. So we had this request from the National Health Laboratory Services in South Africa. And I would think less than a 250-word letter that came across to our Research Ethics Committee. We want to establish a national biobank, and we'd like your approval. Our Research Ethics Committee looked at it, and we said, yeah, but now there are going to be issues with regard to informed consent, and we honed into informed consent. And our Constitution, our Bill of Rights of the Constitution, Section 12, states categorically amongst the rights with regard to informed consent, no one can be involved in scientific experimentation without his or her informed consent. So we wrote back to the head of our National Health Laboratory Services saying, sorry, we cannot actually approve your request based on our Constitution and the Bill of Rights, and we referred them to the National Health Research Ethics Council for a decision. So this went to the National Health Research Ethics Council, and they had some discussion there, and wrote to the researcher to say, sorry, that's not in our mandate in terms of our National Health Act, go back to your Research Ethics Committee. So the application came back to us and we looked at it, and then we started doing some homework and we realized that we already had established biobanks within the country. Okay. And we felt that we needed to actually move forward on this before we actually allowed the world to come and take away our specimens. And there's been a lot of concern in the clinical trial situation with regard to our populations being exploited, and we felt that if we didn't do anything, we would have this continuous problem, and we would then be guilty of allowing for a perpetuation of this problem. We really scrutinized our guidelines, our regulations from the ethical and regulatory perspective. We looked at our National Health Act, which actually makes decisions on human tissue. And our National Health Act, together with its regulations, were actually silent in this area. And we looked to see how we could now make some decisions on regulating biobanks from a research ethics perspective, and at the same time ensuring that our diverse populations, all aspects of our diversity were taken into consideration. So how would we actually describe our diverse population? So this is the university that I come from, and clearly South Africa has a large group of people that are actually well educated. We have fantastic infrastructure, and many of our researchers are actually internationally known. Okay, so we have that on the one hand. Okay. And of course, we've come a long way since 1994, since our transition, and you can see we actually embrace each other's diversity. And here at the bottom, we have our group of born frees. So anyone that's born after 1994 are called born frees in the country. And we have a lot of fun in terms of the born frees and celebrating our diversity. At the same time, we have massive groups that actually have not moved in terms of traditional and cultural issues. We also have huge socio-economic disparities. Okay. And here what we see is a situation in 2012 again, mid-2012, and this was the Lonmin mine situation where we have all our groups of miners who rightfully are fighting for a living wage, and they then went into protest, and they were advised by some faith healers, some Isangomas, that if they covered their bodies with a mixture that was given to them by the traditional healer, they could charge into the entire police force that had surrounded, and this is post-apartheid South Africa. There were the entire police force that had surrounded these protesting miners who were only protesting for a living wage, but they could charge into these policemen and nothing would happen. They would be protected by those bullets, okay? So this is where we are in terms of our thinking for the majority of our populations. And of course they did charge into the police office and they were shot. and it brought back fresh memories of pre-1994 to us. Okay. And we have a whole group of Isangomas now coming forward. So we have traditional healers in African traditional healing, not only amongst our Black African communities, but here you can see an Afrikaner woman who's actually gone into African traditional healing. So that's what we have. I was just saying this morning that South Africa is, to Annabelle, that South Africa is a very, very interesting place to live in. We're never bored. We go to bed at night knowing that we're going to wake up to something that would hit headlines the next morning. If it's not Oscar Pretorius or Shrien Divani, who came from the UK and allegedly killed his wife on honeymoon, we wake up to this, the sad realities. Okay. So we're still full of protests. Okay. We are really still full of protests as a society. Now, what's going to happen if we have a national biobank, where we have the majority of our populations still living in an area where they're not individuals, okay? They actually have come down from the ancestors, and they actually an extension into the future. A population that believes that when they die, every bit of their tissues, every bit of their bodies have to be buried with them. Okay. A population that believes where there is trouble in the families, it's possibly because the ancestors are angry. And at times the ancestors could be angry because they haven't been buried in food. Okay. How then would you get them to contribute to a biobank? How then would you get the government to take their tissues? How then would you avoid a situation like this, or the situation that developed at the Marikana mines, okay, where we had our massacres? So this is what we have to deal with. So we sat and we thought about it, and here's our research ethics committee. Okay, we put our heads together and said, what we're going to do is we need to take into consideration scientific progress and development, and at the same time look at how we can protect the best interests of our individual participants in that progress and development, and look to see how we can try to tread these cultural divides very carefully. Okay. So we thought it would be best to have a subcommittee within our research ethics committee that would work on just the issues of biobanks. We've had a whole lot of requests coming through to us in the last 1.5 years. So we've moved beyond the national biobank, but we've had a whole lot of requests for the setting up of biobanks, or for movement of our tissues into other countries that have biobanks. And there's a whole lot of hype in Africa at the moment with the NIH grant, the H3 Africa grant, that's everyone's in competition for. So that would mean have a whole lot of implications with regard to biobanks itself. So we put up this committee. We have 10 members. We made sure that all the members of this Biobanks Ethics Committee have had research ethics training in some form or the other. Okay, and we've just run a course for our institution on research ethics. So our community representative, who was not well trained in research ethics, went through that course as well. Okay. And as you can see, we have a mixed bunch of people. We got a CEO of a biobank to join us. And she's had her biobank for the last 5 years, well established. We knew nothing about biobanks, so we thought, let's work with each other, let's learn from each other. And she's joined us, and she's actually been very excited about learning and understanding about the ethical issues, the ethical regulatory issues, and it's ended up being a team way forward rather than a them and us. It's now a we. We've got legally trained individuals. We have 2 of them, and we have people trained in areas of research that would actually involve biobanks. What were some of the concerns besides the cultural concerns? We were really concerned about this open and evolving nature of biobanks. And we were concerned about more the social implications for informed consent, privacy, individual and group autonomy, secondary use of samples and data over time, data sharing, benefit sharing with the communities was of major concern to us. The other concern was there's increasing international collaborations, but there are differing positions internationally between countries. There are different jurisdictions. And what we felt very strongly is that when we put together our policy, our South African standard ought to be the minimum standard. If our tissues and data went into another country, they ought to have the same standard or a higher standard. We were not going to accept for our tissues to move into a different national boundary where those tissues could then be abused. We looked at issues around these advances, and we felt that while it was important for us not to be left behind in the scientific arena and the healthcare arena, we felt it's important that whatever advances that we allowed had to be balanced by a concern of the interests of our research participants. And coming from a very human rights and human dignity-based country, we felt that respecting and upholding our participants' human dignity and their fundamental freedoms and human rights ought to be the non-negotiable imperative. Because we've also had problems with researchers, research misconduct, and researcher integrity, we stressed that if research is conducted in terms of biobank research, we would need to scrutinize our researchers to ensure that they had to be responsible researchers. Quite lofty. I don't know how we're going to do it, but we're going to aim there. The bottom line as well was for us that if we were going to allow the establishment of biobanks, a success of this would depend in part on people's willingness to contribute. Okay, so there's got to be that informed consent process. Okay, and we looked at the stage before informed consent. Okay. You can't get involved in an informed consent process if you don't know what this whole initiative or the enterprise is about. So we felt that it would be important to start building public trust from the outset. So we'd want to see community development programs in this direction. We looked at what the risks of biobank research is, and we realized that the physical risks would be rare, and the risks would be more of a social and dignitary type of risk. However, we did keep at the back of our minds that although physical risks would be rare, should there be discrimination and stigmatization, this could then lead to the possibility of physical risks. Okay. And we're very, very, very conscious of discrimination based on research in the country, and that's because of where we've come from pre-1994. And we have been concerned that genetic research from biobank research could actually be used to, may be used to actually propagate racial discrimination as well. So we felt it was important that we drew our researchers' attention to protecting against situations like this. The other thing is we have a huge multicultural diversity, and we respect everyone's religions over there. And we have lots and lots of discussions on issues like, for example, termination of pregnancy. And so we've got a Termination of Pregnancy Act that most of us have bought into, but others haven't. And we felt that there could be a problem with dignitary risks when samples that were contributed could be done for research on things like termination of pregnancy, something that the individual may not actually go with, where, because of religious and conscientious beliefs. However, we stressed that when analyzing risks and benefits, it would be important to weigh the potential benefits of the knowledge to be gained from biobank research against the potential harms for participants and society. And this was the message that we would need to take out into society. Now, at the time that we put together this Biobanks Ethics Committee, and we drew from the old Helsinki, the 2008 Helsinki, which talked about the use of identifiable human material and data, and stated that in such situations the research may only be done after consideration and approval of the Research Ethics Committee. And we used this as ammunition, okay, to set forward our policy. And we were actually very glad, and our policy now needs to be changed to include the 213,000 version, which actually then specifically mentions biobank or similar repositories. And we felt that this, as the Helsinki, this particular section of the Helsinki has now put an added responsibility on Research Ethics Committee members as substitute decision makers for biobank research. While we were putting together our policy, we actually looked quite deeply at justice, and we felt that it was important that justice and benefit sharing went together, and especially in light of what we see with regard to what we call safari research in the country, where we have so-called collaborations, where we have movement from the developed world into our parts of the continent, where researchers come in, set up their research. As soon as the research is over, the collaboration is over, they pack up their tents, they go on safari, and then out, with nothing left for our populations, with nothing left for our researchers and our institutions as well. It's still a reality, the 90-10 divide in research. So we had to protect against that, and where we had collaborative research, and we're having a lot of collaborative research with requests for movement of samples between biobanks, we needed to see how they would approach benefit sharing. And we've used 3 aspects of justice to actually assist us in developing our policy: compensatory justice, which means that the individuals, groups, or communities need to be able to receive fair compensation in return for their contribution. So if they're going to be contributing samples and their data, they've got to receive fair compensation for this. How do you work out that fair compensation? And for that we would need to bring in the concept of procedural justice. And we felt that this is where our Research Ethics Committee came in and contributed towards setting up those procedures. And then, of course, being in the 90% of the world, we felt that it was important as well to look at distributive justice in terms of an equitable allocation of accesses, equitable allocation and access to the resources and the goods that actually emanated from that biobank research. And this is basically our current situation. I mean, not only do we have disparities between the rich and the poor in the country, but there's disparities between those sponsoring research, which is usually those, yes, this is quite an anemic pointer, between those sponsoring, and that's usually from the developed world, and us in the developing world. And therefore, it's very, very important, what do we learn from history? And it's important to take those lessons forward and to safeguard against exploitation. I've talked about public trust being very, very important. What we did find in South Africa was our Department of Health had already in 2004 put together something on human repositories, okay, for us in our research ethics guidelines. So these are national guidelines for us. And what the only thing they said there was they gave a brief description of what a human repository is, but again said the Research Ethics Committee would need to oversee the operations of the repository. Very much similar to what the Declaration of Helsinki said, although the Declaration of Helsinki was more on informed consent issues. So, if you're interested in our policy, here it is. You can access it from this website. It's actually built into university policy, and no researcher involved in biobank research can actually now get into this sort of research without actually looking through our policy and developing their research according to our policy document. Now, what's the role of the Biobanks Ethics Committee? It's been to develop the principles, policy, and guidelines, and this is for the review and approval of applications for the establishment of biobanks. We also not only developed the principles, but the work of the BEC is also to review all applications for the establishment of biobanks and to make recommendations to our big committee. Okay, so the Biobanks Ethics Committee basically works under the umbrella of the big Research Ethics Committee. And the other job of this Biobanks Ethics Committee is to review all research using tissue samples and or associated data from approved biobanks and make recommendations again to our big committee. And the final approval is then taken after a discussion at the level of the large committee. Our preamble stresses the importance of respecting the human rights and freedoms of our participants, and this ought to be in line with our Bill of Rights of the Constitution and any other pertinent South African law. We also state in our preamble that there's a need for harmonization of governance of biobanks, especially after we've seen there are a few biobanks that have already been established without any uniformity in terms of governance. And we've also stated that our biobanks resources have to be embedded within health systems. So the biobanks could not go and can't go and get themselves set up within other systems. It's got to be within our health systems. And where biobank information is going to be exchanged, there's got to be sound scientific rationale for this. Okay. We've stated categorically that the objectives of biobanks that we oversee, the objective will have to be to foster research. And because we didn't want it to seem as if ethics was being obstructive again, this is what research ethics committees unfortunately have a reputation for being, and that is obstructive. We felt that it would be important to emphasize that in terms of the objectives, the data and materials had to be made rapidly and widely available to researchers. And this was basically to advance knowledge and understanding of human diseases. We have several principles in our policy. So stakeholder consultation is very, very important. You can see the other principles, but in terms of material transfer agreements, we've built that into our policy. So what happens to the materials when they leave our biobanks? What happens when they get to the biobanks outside this country? What are the fate of the materials? And in terms of the material transfer agreements, there's got to be the benefit sharing built in there as well. This is our first approved biobank. Okay. And we have a whole lot of other applications awaiting approval. We're still going through the applications. The other thing that we did was we introduced this training, ethical regulatory training in our postgraduate training programs at the university, and currently we have a master's in bioethics and health law. We have a research ethics unit, and we spend 1 day, full day within the block release of that unit going through the ethical regulatory aspects of biobanks. And we have at this moment in time 2 students who are at the research report phase doing research on biobanks, and we've managed to get a PhD student who registered with us, who's now working on an ethical legal framework for the regulation of biobanks in South Africa. So that's how we've handled it. And these are some of the key points that I leave you with. And with that, I'd say thank you for your attention.
Thank you very much. And this reminds us of the huge task we have in WMA. Not only looking at things from a platform of North America or Europe, but also to take into consideration the huge diversity in the societies of the world. So, are there questions from the audience to us?
No, I just want to affirm you're not that far behind. There's not much difference, and actually you have done a lot of homework there already, which others haven't done. And we should not forget that there is a lot of research with biobanks, which are informal biobanks, and collections of specimens and data which is being done, which currently follows probably no guideline at all. And that happens pretty much everywhere, I guess.
Well, that's quite a relief of mine.